Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings. I am pleased to welcome you to the multimedia summary for the journal's February 2026 issue. There are 4 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is an original article entitled Body Fat and Cardiometabolic Disease Burden and All-Cause Mortality in Adults with Normal Body Mass Index. It is authored by Dr. Zuo Chen from the China Academy of Chinese Medical Sciences in Beijing, China, and colleagues from Mayo Clinic in Rochester, Minnesota, and Beijing University of Chinese Medicine in Beijing, China. Obesity, a chronic state characterized by excessive adiposity, predisposes to diverse diseases. Obesity is commonly defined by body mass index, BMI, but a limitation of this index is that it does not directly assess body fat. Indeed, BMI, when initially introduced, was never intended to be other than an index for comparing body weights of individuals varying in height. Moreover, even for individuals with normal BMI, the amount of body fat may have pathogenetic significance, and this subtype, normal weight obesity, is of mounting interest. Chen et al. Examined whether increased body fat in individuals with normal BMI associates with cardiometabolic diseases. These investigators utilized the U.S. National Health and Nutrition Examination Survey, NHANES, which assesses the health of U.S. adults and children based on personal and demographic data, medical history, health exams, and laboratory tests. Surveys from 1999 to 2016 and 2011 to 2018 were analyzed. BMI was categorized as normal, 18.5 to 25, overweight, 25 to 30, and obesity greater than 30 kilograms per square meter, and body fat percentage was quantitated from dual energy X-ray absorptiometry, DEXA. The data demonstrate that of the study sample of more than 20,000 participants, less than 1/3 had normal body weight by BMI. Following adjustment for relevant potential confounding factors, each 10-unit increase of body fat percentage was significantly associated with a 4.5-fold, 3.2-fold, and 1.8-fold increased risk for insulin resistance, metabolic syndrome, and dyslipidemia, respectively. Additionally, this increase in body fat percentage was associated with all-cause mortality. Insulin resistance was associated with body fat percentage tertiles for both sexes. The strengths of this study include a large sample size and one representative of the U.S. population, the use of DEXA to determine body fat, and a follow-up period that examined the association of body fat and all-cause mortality. There is a tendency to overlook the significance of body fat in individuals with normal BMI, but as clearly shown by Chen et al., such complacency leaves unaddressed an increasingly recognized risk factor for cardiometabolic disease and all-cause mortality in these individuals. Our first highlight article this month is an original article entitled Visceral Adiposity Index is Associated with Cardiometabolic Multimorbidity and Improves Risk Prediction, the English Longitudinal Study of Aging. It is authored by Dr. Sito Knutso from both the University of Manitoba in Winnipeg, Manitoba, Canada, and the University of Leicester in Leicester, United Kingdom, and colleagues from the University of Seoul, the University of Eastern Finland, and Wellbeing Services County of Central Finland. Compared with subcutaneous and other types of adiposity, visceral adiposity may be especially harmful as it promotes endothelial dysfunction, inflammation, oxidative stress, a procoagulant state, and insulin resistance. In a prospective population-based study, Knudsen et al. Examined the association of visceral adiposity and the risk of cardiometabolic multimorbidity. These investigators utilized the English Longitudinal Study of Aging, a nationally representative cohort study of individuals 50 years and older. Baseline data were collected at years 2008 to 2009 of this study in participants who were free from hypertension, coronary heart disease, diabetes, and stroke. Participants were followed for 12 to 15 years, during which cardiometabolic multimorbidity was assessed. Cardiometabolic multimorbidity was defined by the occurrence of 2 or more of the following conditions: hypertension, cardiovascular disease, diabetes, or stroke. Cardiometabolic multimorbidity developed in 197 participants. The Visceral Adiposity Index, a sex-specific index, was calculated based on equations that incorporate a combination of anthropometric parameters, waist circumference and BMI, and metabolic parameters, triglyceride and HDL-C levels. The data demonstrate a largely linear relationship between the Visceral Adiposity Index and cardiovascular multimorbidity. Following adjustment for relevant potential confounding factors, each 1 standard deviation increment in Visceral Adiposity Index was associated with higher odds of cardiometabolic multimorbidity. Moreover, the Visceral Adiposity Index, when added to conventional risk factors, improved risk discrimination. The authors underscore several reasons why this index provides a usable, reliable surrogate for imaging techniques such as DEXA, which are expensive and may not be readily available. This index utilizes information that reflects fat distribution and metabolic parameters, and it is non-invasive, relatively easy to calculate, and inexpensive. This index, when included with conventional risk factors for cardiovascular risk factors, improves risk prediction. This novel and timely study by Knudsen et al. Highlights the clinical significance and utility of the Visceral Adiposity Index. Our second highlight article this month is an original article entitled Association of Body Fatness with Hypertension, Dyslipidemia, and Myocardial Infarction in a multinational pooled cohort. It is authored by Dr. Vivek Kumar Prasad from the University College London in the United Kingdom and colleagues from several universities and institutions in the United Kingdom, South Korea, the United States, and India. Prasad et al. Employed a multinational pooled cohort based on data derived from the UK Biobank and the US and Korean National Health Nutrition Examination surveys. Body fat was evaluated by body fat percentage and trunk fat mass index, both of which were quantitated by DEXA. Cardiovascular disease was assessed by 3 approaches: hypertension, dyslipidemia, and myocardial infarction. The analysis involved more than 30,000 women and somewhat fewer men, aged 40 years or older. The data demonstrate that the relative risk of hypertension significantly increased across quintiles for body fat percentage in men with normal body weight, overweight, and obesity, and in normal weight women. The relative risk of dyslipidemia significantly increased across quintiles for body fat percentage for normal weight and overweight men and women. When trunk fat mass index was employed, The relative risks of hypertension and dyslipidemia across all quintiles for this index were observed in men and women with normal weight, overweight, and obesity. The relative risks of myocardial infarction significantly increase across quintiles for trunk fat mass index in men with normal weight, overweight, and obesity, but no such relationship was seen for women or for either sex when body fat percentage was analyzed. The authors conclude that increased body fat of individuals in a specific BMI category increases the risk of both hypertension and dyslipidemia. The lack of analogous findings with myocardial infarction, the author suggests, may reflect variation in adherence to or adequacy with management of assorted risk factors for cardiovascular disease. The strengths of this study include a rigorous method for assessing body fat, a unique multinational pooled cohort, and the unequivocal finding of association between body fat and cardiovascular disease, even in individuals with normal BMI. In early 2025, the Lancet Diabetes and Endocrinology Commission comprehensively addressed, among other considerations, how obesity is defined and diagnosed, the limitations of BMI and the need for anthropometric indices, the differences between preclinical obesity and clinical obesity, and the complications of the latter, and whether obesity is more than just a risk for disease, but rather justifies consideration as itself a distinct disease. Notably, there is a heterogeneity of opinion in the obesity field, including the clinical significance of varying ranges of anthropometric indices and exactly how body adiposity is quantitatively defined. Challenging further the obesity field is an issue highlighted by a research letter in this issue of Mayo Clinic Proceedings. This letter is entitled Shortage of Obesity Medicine Specialists in the United States. This letter is authored by Dr. Simara Singh Bajaj from Stanford University School of Medicine and colleagues from other universities. The letter highlights the shortage of board-certified specialists in obesity medicine, especially in geographic areas in the United States where the prevalence of obesity is high. In conclusion, this editorial brings together evidence elucidating the significance of body fat in individuals with normal BMI, evidence demonstrating that cardiometabolic risks attend visceral obesity, and evidence indicating that body fat within a specific BMI, including a normal BMI, associates with cardiovascular diseases. These 4 papers address different but complementary aspects of obesity, and in so doing advance the field of obesity, a condition rising in prevalence and predisposing to diverse diseases. You can access these highlights and editor's choice articles free of charge during the entire month of February. We invite you to visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online in press. You will also find access to our social media by clicking the links to follow us on YouTube, Facebook, and X under the media icons in the center of the homepage. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Please check out our Pioneers and Legends feature for interesting. Please check out our Pioneers and Legends feature for interesting conversations with leaders in their field. Our homepage also includes a collection of articles that honor the past and look to the future in anticipation of our upcoming 2026 centennial celebration. Our homepage also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are also available through iTunes. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.